Welcome back to PharmaconHealth, where we turn pharmacology into practical knowledge. In this lesson, we dive into the concept of order of kinetics, the specific patterns by which drugs are eliminated from the body. Understanding these patterns helps guide safe dosing and predict how long a drug stays active in the system. Let's begin by exploring the most common type, first-order kinetics. First-order kinetics is the most common elimination pattern. Here, a constant percentage of the drug is cleared per unit time. That means when drug levels are high, the elimination rate is faster, and as concentration drops, elimination slows. Despite this change in rate, the half-life, or time to reduce drug concentration by half, stays the same regardless of the dose. This principle applies to most drugs in clinical use, but not all drugs follow this proportional pattern. Some follow a fixed-rate elimination process, known as zero-order kinetics. Zero-order kinetics and zero-order kinetics, a constant amount of drug is eliminated per unit of time, regardless of how much drug is in the body. This happens when elimination pathways, like liver enzymes or renal transporters, become saturated. Drugs like phenytoin, ethanol, and high-dose aspirin follow this kinetic pattern. Because elimination does not speed up with increasing concentration, there's a higher risk of accumulation and toxicity, especially with dose increases. Now, let's take a closer look at drugs that transition between first-order and zero-order, following a saturable pattern called Michaelis-Menten kinetics. Michaelis-Menten kinetics describes drugs that begin with first-order elimination, but transition to zero-order, drug concentration increases, and enzymatic pathways become saturated. This is particularly important for drugs with limited metabolic capacity. At therapeutic doses, these drugs may behave predictably, but even small increases can overwhelm the system, leading to nonlinear and unpredictable kinetics, raising the risk for adverse effects. Let's now understand the practical implications of these kinetic patterns in clinical decision-making. Clinical implications of kinetics. From a clinical standpoint, understanding elimination and kinetics is essential for safe and effective dosing for drugs with zero-order or saturable kinetics. Even a slight increase in dosage can lead to a dramatic rise in plasma drug concentration, risking toxicity. Therefore, careful dose titration and therapeutic drug monitoring are crucial, especially with drugs like phenytoin or lithium. Recognizing kinetic behavior helps clinicians avoid dangerous drug accumulation and adjust dosing appropriately to support these principles. Let's look at some key equations that describe drug elimination mathematically. Key kinetic equations in pharmacokinetics. Two core equations help quantify drug elimination. First, elimination rate equals clearance multiplied by plasma concentration, showing that as concentratio n increases, elimination speeds up in first-order kinetics. Second, the exponential decay equation, C equals C0 times e to the power of negative kt, describes how drug levels fall over time. These formulas allow us to calculate dosing intervals, predict drug behavior, and guide safe therapy. Now that you understand elimination, it's time to examine the next stage of pharmacology, how drugs act in the body. Thanks for learning with PharmaconHealth, where we simplify pharmacology for better patient care. Don't forget to like, subscribe, and share this video with your peers. Stay tuned for our next episode, where we uncover how drugs interact with the body to produce therapeutic effects.